So warts are a very frustrating and very common problem for people. They're a viral tumor, and when I use the word tumor, I just mean a bump. It does not mean that it's deadly or dangerous. It's just a bump, and it's caused by a virus. They're very common. They're contagious. So if you have a wart and you scratch it and you scratch somewhere else, you can spread that wart. And so it can be quite a problem. There's no one treatment that is guaranteed to get rid of a wart. I will sometimes treat a wart once or twice and have it give up the ghost and disappear. And then I've had patients that we've treated warts and we've seen them back multiple times, and that is a stubborn spot. So we do all kinds of things. For patients who can tolerate it, we'll freeze them with liquid nitrogen, and that stings. It definitely gets people's attentions, but generally anybody over about the age of 8 tolerates it very well. We have a variety of chemicals that we will use that are meant to cause some irritation and encourage that wart to go. There are some medications that are topical creams that we sometimes have success with. Push comes to shove, we can also numb them up and cut them off. There are all kinds of home remedies, and because our immune system is sophisticated and will often get rid of warts on their own, sometimes those home remedies are great. You hear about duct tape, you hear about white vinegar, you hear about all kinds of secret recipes that grandma passed down, and when they work, perfect. When they don't work, it's important, one, to be sure that that's the diagnosis. There are several other skin conditions that can look sort of like warts, or you might think are warts, but they don't respond because they're not. And then sometimes those home remedies, when they don't work, that's when you come see us. When you have a spot that you've treated, and you've treated it several times and it hasn't responded the way that you expected, you have to ask yourself the question, do I have the right diagnosis? Is this really a wart, or is it something else? And that's part of what we're here for, is to help make sure that we have the right diagnosis.